Omicron is here, and it's brought a wave of uncertainty on the science. How fast will it spread, and with what damage?
It's not going to be enough to really curb the transmission.
On the lives of exhausted Canadians, how should we act right now?
We as parents were really tired of this.
And on governments, what's the right balance for collective action?
If the message here today was we're canceling Christmas, people would tell us to take a hike.
Tonight, we take on the questions rippling ahead of the wave.
Will the definition of fully vaccinated be changing to 3 doses?
The answers flow from the science we do know, the exhaustion we do feel, the action we do need.
I must call on the solidarity of all Canadians.
Confronting Omicron. This is a special edition of The National.
And we welcome you to the National Studio here in Toronto. Tonight, we have complete coverage of the push to contain this variant and what it means for Canadians.
By now, the variant is all over Canada, all over the world, and it's moving pretty fast, infecting people at a far greater pace than Delta.
And so changes are coming fast too. New warnings, new advice, and a new crushing prospect for many that COVID could once again cancel holiday plans. Now, tonight, we'll explain what the federal government is now saying about international travel, and we'll examine the race underway to get third doses into arms fast. We'll also lay out how Omicron could change other plans for kids' vaccine doses, their school year, and for all those arenas still packed with fans.
And through the hour, we will have the experts on hand. Infectious diseases doctors Alexander Wong, Lisa Barrett, and Zain Chagla will help us sort out the science, the risks, and what could lie ahead.
Well, let's begin tonight with a big change affecting your travel plans. Many Canadians were counting on finally getting away for the holidays this year, but what seemed safe a few weeks ago is changing. Hannah Thibodeau is at the Ottawa International Airport tonight. Hannah, the message, stay home.
Yeah, don't let this quiet Ottawa airport tonight fool you. We know that it's 10 days until the Christmas season, and the rush really is already on. So with today's announcement advising Canadians not to travel internationally, it has a lot of people worried.
It's a little nerving, kind of scary.
The Omicron variant is increasing travel stress for many. And the federal government agrees it's unpredictable. Now advising Canadians, if you have international travel plans, cancel them.
We are asking Canadians to be cautious heading into the holiday season. If you do not have to travel internationally, please do not.
For those heading out today, mixed emotions.
It makes me a little nervous, but again, I'm vaccinated and I'll be sure to take safety precautions.
I'm not uber concerned because we're vaccinated.
If no one had a choice to travel, I think we'd all be a lot safer.
Sources say the Prime Minister discussed much stronger measures with the premiers on a call Tuesday night, including stricter quarantine and testing to enter the country. But he faced pushback.
If one of the benefits that come with vaccination is the ability to travel, we don't want to take that or significantly impair that benefit. We have to maintain some sensible balance here.
But some of those options could still be on the table.
I think that there's other measures being under active discussion at this point.
And experts warn things could change at any time.
Rules are evolving. There's costs involved to the testing and the quarantine. So you have to keep that in mind when you travel and realize that the unexpected costs and the unexpected change of plans can be considerable.
The Prime Minister acknowledges this is not what many travelers want to hear.
I know after the year we've had, after the almost 2 years we've had, people were really looking forward to getting away, to not having to think about COVID. But the reality is we have to think about COVID. I understand this sucks.
Sucks, but you know, the government says this advisory will last for 4 weeks for now, Andrew.
And so, Hannah, when might we hear if any more measures are being put into place?
Yeah, so some of those new travel measures that we're hearing about in the story, we are expecting to hear, sources are telling CBC News that we expect to hear something as early as Friday, and that is just days ahead of the highest peak of travel in the season.
Indeed. Thank you very much, Hannah.
So let's bring in Dr. Zane Chagla in Mississauga. Dr. Chagla, to what degree is a new travel advisory likely to be effective, considering the variant is already doing a pretty good job of spreading quickly in Canada?
Yeah, I mean, I think this is a global pandemic, right? And we're seeing Omicron everywhere. So, you know, yes, people do need to be careful with travel, but at the same time, I think people are allowed to make their decisions around travel and recognizing that what can happen on our soil can happen on someone else's soil. Our job should be making sure that people coming back to Canada don't have COVID, and using testing as part of that, but not necessarily discouraging travel, letting people be aware of what the requirements are when they come back to Canada.
Okay, fair enough. Thank you.
Now let's look at the numbers helping to drive some of these new restrictions across the country and in the province, quickly emerging as Omicron's epicenter. Today, Canada surpassed its fall peak by several hundred cases, with almost 5,900 new infections. But look at Ontario. It exceeded its fall peak more than 2 weeks ago, and today almost doubled it, more than 1,800 new cases and climbing. Now it is estimated as many as half of Ontario's cases are Omicron. That's up from just 10% late last week. So now the province is taking action. Ellen Morrow takes us through it.
At this vaccine clinic, a rush for third doses as Omicron speeds through Ontario.
The Omicron is very scary.
The new virus, right? So you got to protect yourself.
And starting Monday, Ontarians 18 or older, 3 months past their second shot, will now be eligible for their third.
Nothing matters more than getting these third shots into arms.
Premier Doug Ford says Ontario is ramping up against a new enemy, restarting more mass vaccination sites as some already eligible for boosters struggle to find an appointment.
It's going to be a little bit of vaccine Hunger Games over the next few days, but hopefully by Monday, everything is much more available.
Ontario is also making rapid test kits easier to find, handing out 2 million at malls, liquor stores, and on transit in what it calls a holiday testing blitz.
It's about time. I think this is about 3 weeks overdue. Yeah, so I'm going to take as many as we can get.
If there's lots of them around, then get them out, get them into people's hands.
Scores! The only new restriction from the province doesn't start until Saturday. Venues with a capacity of 1,000 or more will be capped at 50%. The musical Come From Away returned to the Toronto stage just hours after the announcement. Tonight's first full house will also be one of its last, at least for a while.
Now it is getting a little scary again.
I have triple vax and 5 masks. I'm ready.
But some healthcare experts argue more restrictions are needed, cautioning against crowded bars and restaurants this holiday season.
This virus is so incredibly infectious.
We got to pull out all the plugs. And I don't think people understand just how serious the threat is.
The concern now preserving the healthcare system, with so many Ontarians still unvaccinated or not fully immunized, and a surge of cases coming.
And so, Ellen, what did Premier Ford say about the possibility of further restrictions?
Well, Premier Doug Ford, Andrew, repeated something we've heard him say throughout the pandemic, that all options are on the table. But he also said a lockdown is not the solution. And public health experts are not calling for a lockdown, but they do say Ontario needs to buy itself time, give itself room to quickly boost as many people as it can, as quickly as it can. They say that's where those stronger restrictions can help. And Andrew, these healthcare workers are exhausted, and they're fearful with that dire prediction from the head of Ontario's science table, Dr. Peter Uni, that with this variant, the province could see up to 10,000 cases a day by the end of the month.
Okay, thank you, Ellen.
You're welcome.
So obviously it's not just Ontario trying to keep a lid on the situation. Daily COVID infections are climbing almost across the board. So that includes most of Atlantic Canada, but the biggest jump, Quebec, with almost 2,400 cases. That's its highest single-day count since back in January. Alberta, over 450, almost doubling yesterday's count. And BC reporting 584. That's its highest in 8 weeks. The good news, hospitalizations so far are holding steady. Still, health officials are bracing for more cases thanks to Omicron. Here's Olivia Stefanovich on the different approaches provinces are taking.
We have just received confirmation of our first case of Omicron.
With that, all 10 provinces are reporting cases of the highly transmissible variant.
Please, take a breath. Don't panic.
Despite the call for calm in one corner of the country, other officials are sounding the alarm.
We all need to reconsider our holiday plans.
In Manitoba, officials are asking people to get their third shot before gatherings for the holidays.
This really needs to be the most important item on your holiday season to-do list.
That province projects an explosion of cases, 1,000 a day in the new year. Already, ICUs are at the brink.
The current situation in Montreal is not really what we were planning or expecting 2 weeks before Christmas.
But nowhere are cases spiking higher than in Quebec, and boosters are just part of the response. Officials are now urging more people to work from home and to make use of rapid tests as much as possible as they roll them out through pharmacies. In BC, officials are urging people not to travel if they don't have to.
If it's not necessary, don't go.
But in Alberta, a very different strategy, easing some restrictions.
The notion of isolating a whole lot more people for the second straight Christmas, unable to have any contact with family, I think could have a devastating impact.
Also allowing unvaccinated to attend indoor private gatherings, acknowledging that people are weary and may not tolerate new measures.
This still keeps us with the most stringent rules. But at the same time, we have to be mindful after 21 months of this, of the willingness of the public to actually comply with the rules.
And that's the two-front battle facing government officials, COVID fatigue and the exponential growth of this highly infectious threat. Olivia Stefanovich, CBC News, Ottawa.
Okay, so let's bring in Dr. Alex Wong in Regina. Dr. Wong, so we see, several different approaches depending on where you are in the country. What does the science tell us should be the next steps here?
Really, Andrew, there's a few key things that I think the entire country needs to move forward with quickly. One is that we need to get as many vaccines into arms as quickly as possible. We know that 3 doses is better than 2 in this situation, so that's a huge one. We need to really look at limiting big indoor gatherings and really encouraging people to keep their bubbles tight, upgrading masking, upgrading ventilation, acknowledging the fact that COVID is spread via airborne transmission, using the rapid antigen tests that have been already discussed, and really remember to stay home. If you're symptomatic, don't spread COVID to other people.
So, Dr. Wong, just thinking about what Premier Kenney said about, would people comply with restrictions if they came in? He might have a point. To what degree will COVID fatigue play into this, and what can we do about it?
It's a reality, and especially for provinces like, for example, in the prairies where, a lot of the messaging has been, that COVID is kind of largely done. It's hard to pull back, once you've got that messaging out there. So we need to be very clear with our messaging to the public, and we need to acknowledge the significance, the magnitude of the problem, and talk about what I think society cares about most, which is keeping schools open, keeping our economy open, minimizing disruptions, and keeping our hospitals open to serve everybody as needed so that we don't have to strain like we have with other waves. Those are some of the pieces that I think are going to help in terms of encouraging the public and encouraging individual citizens to do the right thing.
Okay, Dr. Wong, thank you. So as you heard in Olivia's story, boosters are seen as the first line of defense against this variant. But even if you're eligible, they're not always easy to find. Provinces are up against the clock, trying to scale up to get those shots into arms. Alison Northcott is looking at that angle for us tonight.
There was one simple reason 76-year-old John Neves got his third COVID-19 shot.
To be reassured. That's all. It's simple as that.
With Omicron spreading, experts say getting a third shot to more people is crucial, and provinces need to ramp up.
In general, provinces were slow to realize that it was important and urgent to give the third dose.
This immunologist is on the federal government's COVID-19 vaccine task force.
The system that was developed to give the first and the second dose has been pretty much shrunk, and as a result, they don't have the ability that they had.
Eligibility for boosters varies from province to province. In Quebec right now, it's for healthcare workers and people 60 and up.
We're looking at every available option to get the shots into arms with no delay.
Ontario and Manitoba have expanded third doses to all adults, and Alberta to healthcare workers and people 50 and up.
The reality is we can only increase appointment availability at the pace of the supply that we have procured by the federal government.
Go and get your booster as soon as you are eligible. We have enough for everyone.
The federal government says supply isn't the problem. It says shots are being delivered to the provinces and territories with 16 million doses in stock and more to come. But in many places, it's hard to get an appointment.
We definitely are seeing an increase in demand for our services.
Talia Pankowitz volunteers with a group that helps Canadians find vaccines near them.
We're hearing a lot of relief from people who can't find bookings. We are also hearing a lot of frustration. Different jurisdictions in Ontario and cross country are hitting rollouts at different speeds.
Quebec says it plans to reopen some of its mass vaccination sites, but it needs to recruit hundreds of people to administer more doses. Alison Northcott, CBC News, Montreal.
Now, for kids, third doses aren't an option yet. And with Omicron spreading rapidly and some restrictions being put into place, parents are worried about what that could mean for the school year. Some provinces are even starting holidays early as schools try to figure out what to do. Katie Nicholson has more.
Rubini Siva picks her daughters up from school, a daily ritual, but for how much longer?
I'm certainly worried because with what's going on right now, the government might just turn the table and say, hey guys, it's not safe for our kids to be at school anymore, so let's just go back to virtual learning.
Something Siva says was especially hard for her oldest daughter.
She was very withdrawn, she couldn't see her friends, she was very unhappy.
As COVID cases soar, no big decisions from Ontario yet. But the province's largest school board sent out this memo, urging parents to be sure your child brings home all of their personal belongings in case they have to pivot to remote learning for a period of time. For its part, Nova Scotia decided to pull the plug on most in-school learning this Friday, an early Christmas vacation. It's just a few days, but a relief for teachers.
Hopefully this gives everybody some comfort. Obviously, teachers reporting to work next week, have some additional time to prep and plan, depending on what happens with epidemiology. If there needs to be a shift to remote learning, we got a little bit of breathing room to do some prep for that.
New Brunswick is starting its winter break a week early and is now also planning a holiday rapid testing blitz for students.
This is a balance between what I know that some parents would like, which is seeing schools shut right now and for as long as possible, and others who continually email me and say, why do our kids have to wear any masks, and let's just let this go.
You have to take it.
In Toronto, not exactly a blitz, but one of Rubini Siva's daughters was sent home with a rapid test, and the province plans to distribute millions more to schools.
Every child could be provided with a rapid antigen test. Then we all can safely check our students. If they're negative, they could probably safely go back to school instead of introducing this virtual learning all over again. We as parents were really tired of this.
Anything to make sure their home doesn't once again become their homeroom. Katie Nicholson, CBC News, Toronto.
Dr. Lisa Barrett is in Halifax. Dr. Barrett, do you think the benefit of closing schools outweighs, the damaging effects of it?
I think we have to look at this in terms of short-term weeks, 2 weeks before Christmas, 2 weeks after right now. We're learning quickly that Omicron moves faster. I mean, the sleigh is just moving so fast. In the next 2 weeks, we need to be definitive, quick, and make sure that we keep cases as low as possible and protect kids. We've always said that means keeping the virus low in the community, and we really should concentrate on those efforts over the next number of weeks. Would 2 days, 3 days of early vacation make a big difference? It might to spread among unvaccinated kids and probably wouldn't cause a huge effect that's long-term damage. What happens after Christmas is a little different, and I think we need to remember using all the tools in our toolbox to keep kids in school in the new year will include boosters, but we are going to have to use testing and other preventative measures to keep them in school in the new year. So let's hope we can divide this into 2 sections before and after Christmas and be rapid and definitive and take a community approach.
Okay, good strategy. Thank you.
Now, of course, it's not just Canada trying to get a handle on the Omicron variant ahead of the holidays. Countries around the world have been forced to take measures to protect their populations. Susan Ormiston brings us the global picture.
England's chief medical officer looked dour.
This is a really serious threat at the moment. How big a threat? There are several things we don't know, but all the things that we do know are bad, and the principal one being the speed at which this is moving.
COVID cases are breaking records in England, mostly Delta still, and hospitalizations flat. But Omicron's potential to double every 2 to 3 days is sending Londoners to queue up for booster shots, the most effective protection, scientists say, against the new variant.
Our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster.
The U.S. is pushing again a 3-point strategy: mask up, get the vaccine, then boost it.
If we didn't have these tools, I would be telling you to really, really be worried.
A South African study this week suggested Omicron produced less severe illness than other variants, but cautioned it's early.
Africa is now officially in the 4th wave of the pandemic, which is partly due to the Omicron variant.
Across Europe, French ICUs are filling up, healthcare workers dreading a surge, driven still by Delta. But the European Union warns it can expect Omicron to be the new dominant variant by January. The U.S. hasn't imposed new travel guidelines, but after 1 full year of vaccines, nearly 1/4 of Americans are not protected.
I had hoped by now each one of you who have helped us get to where we are would have had full access to the White House.
President Biden breaking the news to the Democratic National Committee. No invite to the White House halls this holiday. Omicron, the party crasher. As Congress marked a grim tally, 800,000 Americans now have died of COVID. Susan Ormiston, CBC News, Washington.
Back here at home, of course, Canadians forced to confront the realities of Omicron too, which is why we are bringing you a special edition of The National.
Yeah, as we get new information on the variant, new public health advice from officials, we're also getting new questions from you.
Just how risky is it to go ahead with my plans?
What advice would you give to parents making decisions around sending their children to places like schools, hockey arenas, etc.?
I am just out shopping for the day, and I have definitely got a question.
Tonight, we're putting your concerns to the doctors for their advice on how to navigate this new stage of the pandemic.
Plus, what you need to know if you're planning to use rapid tests to stay safe over the holidays. What is this actually detecting?
And as Omicron spreads, some parents want to know, what is the best amount of time to wait between their kids' vaccines?
I don't think people know that they can accelerate the second dose.
We're back in 2 minutes.
Well, welcome back to a special edition of The National. Tonight, confronting Omicron as the new variant makes inroads all over this country and raises new concerns. We're putting your questions front and center.
And of course, we have experts on hand to help. Infectious diseases physicians, Dr. Alexander Wong, Dr. Lisa Barrett, and Dr. Zane Chagla, all with us throughout the program tonight.
For many Canadians right now, the very big question, how will Omicron affect holiday plans, including travel? Well, today the federal government advised people against leaving the country, prompting this question to us.
Hi, Dan from Fort Erie here. Now that the government has advised against any unnecessary international travel, I have booked a trip to Cuba for the new year. Just how risky is it to go ahead with my plans?
Dr. Barrett, poor Dan, what would you say to him?
Oh, Dan, I feel for you. I really do. And I think we'd all love a palm tree or two in our near future. Tough to know these days right now. So recognizing that this Omicron variant, as mentioned earlier, is already present in Canada, this is not just about preventing Omicron from coming here. It's about understanding and keeping virus as low as we can. And one of those tools is to limit the amount that gets brought in. To be honest, things are changing quickly, and I think no one has a crystal ball right now. whether it's impossible to know whether you're going to have to cancel or change something. But the take home is we do have a lot of tools if you do decide to go. Do your risk assessment. Make sure you stay in places that do not have high areas of COVID for your own personal safety. Only go if you're fully vaccinated, obviously. And when you come back, there is this part of the testing that needs to happen. So being sensible, being mindful, and looking at the risk of where you're going, I think are practical tools right now. And keeping a really close eye on what the epidemiology says, both in Canada and the place you're going, is going to have to be the strategy for the next 2 weeks.
We've got another question for you, Dr. Barrett. This is from Wendy in Mississauga.
Hi there. I am just out shopping for the day, and I have definitely got a question. I am super excited about finally being able to have some sort of a Christmas this year, but with everybody coming over, is there a limitation on how many people we should be having in the house? Should we be doing something outside? We're having a little bit of this mild weather. Or, you know, how about rapid testing? Should I just get a bunch of rapid tests and have everybody test, including our family, prior to having everybody in for dinner? Look forward to the response.
And so we have just about 25 seconds for this. A way to gather more safely, Dr. Barrett.
Hopefully with vaccinated folks, if there are vulnerable folks there, yes, do go for the rapid test and have them done the day of. Make sure that if you can do things outside, that's a great idea. If you're inside, make sure everyone is well that day, masks, some ventilation if you can. I know it's hard in the winter. And then obviously keeping the number of social groups that are different and independent as small as you can at these gatherings. Don't have all the gatherings all the time. Some of the gatherings, some of the time this year.
All right, Dr. Barrett, thank you.
So like that viewer, Wendy, everyone is gaming out how to be safe. And when it comes to rapid tests, maybe you're having conversations that sound a bit like, hey, we're vaccinated, let's meet. Can everyone get a rapid test beforehand? Is that familiar? Is it a good idea? Safe enough? Let's sort this out with Dr. Peter Uni, Scientific Director of the Ontario Science Advisory Table. I'm curious, let's say I'm having a dinner party at 6 o'clock. What time do I want my vaccinated guests to do this test?
You can easily do that just when they come, you know, they just would need to wait outdoors, or you just give them the test before. They shall do it immediately before.
Okay, so my hands are clean. In each side, 1, 2, 3, 4, 5. Is that right?
Yeah, you just want enough just in there. Ooh. Great, yes.
Okay. So then it goes into this vial.
Absolutely.
And I mix it around a little bit.
Exactly. It's good mixing, squeezing, everything.
And I snap it off.
That's great.
Whatever it takes. All right. So I put this here and I swoosh this around a little bit. As I get ready to do the next stage, what is this actually detecting?
So first of all, what is important is these tests are really good at finding out whether right now you're infectious or not, because they will be positive if your viral load is high. And that's the moment when you're actually able to transmit to others.
Okay, so I have the actual rapid flow here, and I know I dropped just a few drops into it, correct?
Exactly.
I can start to see very quickly that there is a red line that moves across. Okay, so we have waited 15 minutes here. Can you see that?
Looks good.
Okay, so that's negative. And if you do this, let's say at 6 o'clock before this mythical dinner party, and then the next morning you have a mythical brunch with vaccinated people as well, do you recommend you do it again exactly before that brunch?
If you want to play safe, I would, you know, and right now we need to be aware of that. This is a tidal wave coming. There will be a lot of people out there infected knowingly or unknowingly. They could be asymptomatic. 12 hours is a lot of time for Omicron. You know, this virus appears to be very dynamic. You repeat the story again.
And Dr. Uni adds, too, that the test should do a good job of detecting Omicron because the variant may even carry a higher viral load than Delta. And if you follow the instructions carefully, he says they should be reliable.
Okay, next, we are going to look at what Omicron means for kids and the push to get them vaccinated.
I don't think people know that they can accelerate the second dose.
We'll look at why some kids are already getting another dose only 3 weeks after their first. The National Confronting Omicron is back after this.
Our
5-year-old son recently got his first dose of the pediatric vaccine. We know that NACI has recommended an 8-week interval between the first and second doses. However, with the Omicron variant, we know that other parents have opted to have the second dose accelerated and taken at the 3 to 4 week timeline. Is there a benefit to this? With Omicron emerging, should we consider this, or should we wait for the 8-week interval as NACI has recommended?
Some really good questions there from Kelly in Peterborough, Ontario, and something on the minds of a lot of parents in the face of Omicron. Should kids get their second dose earlier? Christine Burak looks into that.
You did great. Okay, so your next vaccine is going to be in 8 weeks.
That's what many kids and parents are told. But children don't really have to wait 2 months.
I don't think people know that they can accelerate the second dose if they are giving informed consent to do so.
It depends on where you live, but with Omicron spreading in Ontario, Elizabeth Patrick says her son's pediatrician shared her schedule for second doses.
She booked her own kids for the 4-week mark, which is a pretty big endorsement for me.
During Pfizer's trials, children were given their 2 doses 3 weeks apart. That is what Health Canada approved. But based on emerging evidence in adults, the National Advisory Committee on Immunization recommends an interval of at least 8 weeks, saying longer intervals between the first and second doses result in a stronger immune response, higher vaccine effectiveness in the long term, and may be associated with an even lower risk of myocarditis or heart inflammation.
The challenge right now with Omicron here is that we don't know how much protection there is for all of our kids 5 to 11 who are sitting right now with 1 dose.
If it's possible, Dr. Alex Wong says he may move up his son's second shot. Other experts say while it's safe, only a third of Canadian kids aged 5 to 11 have had first doses yet, and lineups of adults waiting for third doses are growing by the day.
We have to prioritize the adults, but if we can get that done, and that's done in certain places, then yes, kids could get their doses sooner.
Christmas ball? Mm-hmm. Yeah.
Luke's mom was able to book his second shot 4 weeks after his first to before Christmas.
It feels like we're entering a new stage of the pandemic, and it's becoming more and more urgent to be fully immunized as quickly as possible.
She knows he might not be protected long term, but expects a booster for kids is coming sometime next year. Christine Burak, CBC News, Toronto.
Okay, so let's bring in Dr. Alex Wong once again, because Dr. Wong, through the magic of television, we just heard that you may be moving your child's second shot up. Is there a downside to shortening that interval?
Honestly, probably not at this point, Andrew. I mean, NACI, when they made the recommendations 4 weeks ago, we didn't even have anything about Omicron at all, and things have changed so much in such a short period of time. You know, I know there's still a lot of questions and concerns about heart inflammation events like myocarditis and pericarditis, but there have been millions of doses given to ages 5 to 11 kids in the US and Canada, and we've seen essentially almost no heart inflammation events thus far. We just don't know with Omicron, and again, a huge piece of vaccinating our kids is preventing infection, and we know a single dose is probably not going to be as good with Omicron compared to 2 doses. So I'm going to try to probably move our son's dose up, to the 4-week mark, and to try to get him protected before he goes back to school in January. And, I think that's the right thing to do in this situation.
Okay, Dr. Wong, we have another viewer question for you. This one from Mandy in London, Ontario. Have a listen.
Given the ample evidence that COVID is airborne and ventilation is an important mitigation measure, what advice would you give to parents making decisions around sending their children to places like schools, hockey arenas, etc.?
Okay, complicated question there. Kids 5 to 11, only single dose, those who have it already, the younger ones, not at all. How do people weigh the risks in public spaces?
Yeah, thanks, Adrian. This is tough. I think you got to look at all the individual risks and considerations at play. With Omicron, as we've discussed, there's a high risk when you're in an unmasked, poorly ventilated indoor setting, like an arena, for example, or like older schools. You also have to look and see who your bubble contains. And if you have elderly persons, persons who are medically vulnerable, that's probably a situation where you probably want to be more cautious as well, honestly, given the transmissibility of Omicron. So we need to balance this with the importance of having our kids be at school, be involved in sports and extracurriculars. If they're fully vaccinated, you've done everything you can in order to keep your kids safe. Then I think you just make the decision that you feel is right and you move forward with that and be good with it.
Okay, thank you.
Now, given how infectious Omicron is, the type of mask you wear could be more important than ever.
Maybe 20% protection. So there's about 80% of the particles be getting through.
20%.
Absolutely.
So we will break down which type of mask can protect you best and how to wear them properly right after the break.
But maybe 20% protection.
Yeah, it's a cause of worry because we do not know what exactly will gonna happen, because there are no clear results how it will gonna impact us.
My birthday is on the 16th of January. I've planned a party, private party, close to the public at a bar that's near my house, and I don't know if we're going to go into another lockdown. And my birthday's going to be ruined. 3 years.
Welcome back. We have already heard tonight that upgrading masks will be a key part of controlling Omicron. So this afternoon, I caught up with Paul Bozak, a professor at the University of Toronto. He has done extensive fit testing on masks, and I had a lot of questions about which ones are most effective against Omicron and what happens when you wear them incorrectly. What's the range in quality here as I'm looking at all the masks on this table?
So the cloth masks, it really depends on double layer, single layer, type of material, but maybe 20% protection. So there's about 80% of the particles be getting through.
20%?
Absolutely. Surgical masks are definitely better in terms of the filter material, but they're not meant to fit tight. So you can get a significant amount of leakage, probably around 50% of the aerosols getting in that we'd be concerned about.
Half of the aerosols still getting in through this because of all the holes. It doesn't fit properly.
Yeah, it's not meant to fit properly.
And all of that compared to KN95, N95 masks, how do these stack up?
So the KN95s and the N95s are meant to be at least 95% in terms of the filter material itself and its efficiency at stopping particles.
What if you've got one of these, but you wear it like this, below your nose? How much protection are you getting there?
Well, if you're a nose breather, you're getting 0. If you're a mouth breather, you might still be getting 10 or 20%, but basically it's not very effective at all.
It's nearly as bad as not wearing a mask?
Absolutely, yes.
People who are doing Christmas shopping, getting on public transit. Would you feel comfortable wearing a mask like this?
Personally, I don't like wearing the surgical mask. I think it's not protective enough if I'm surrounded with people that I don't know, who may or may not be carrying the Omicron. So I personally go with a KN95 or an N95 if I'm in a high risk or a high occupancy scenario.
Because if we can use the analogy of not wearing a mask being like not wearing a seatbelt, how would you gauge this sort of mask?
Wearing the surgical mask is kind of like wearing the lap belt without the shoulder belt. You've got some protection, but you hope you don't get into trouble and get into an accident.
Huh. And wearing a KN95 would be like what, full seatbelt?
Full seatbelt plus an airbag. It's as much protection as we can offer. Not guaranteed to protect you, but it does a much, much better job.
Okay, so let's bring in Dr. Zain Chagla in Mississauga on this, because Dr. Chagla, I think the hard question here, the million-dollar question is, what do you do for a family gathering that one might be planning this holiday season? You're getting together with people you trust, who you think have been responsible. Are you supposed to wear a mask in that situation?
Look, I think if you're going to eat and drink together, there is going to be some exposure risk there, right? If you're going to stay over, there's going to be some exposure risk there. And so you may want to mitigate your spread through other means, like improving ventilation, like using rapid tests, and again, keeping the gathering small so that you have a set amount of people in terms of risk. As you get larger and larger and larger, though, that's where you start incorporating things like masks in terms of mitigating risk and adding another layer of protection. And so, it really depends on what that gathering is and how long people are together, to which, a mask can offer an added benefit.
Hey, Dr. Chagla, very briefly, I hear all the praise for KN95s. They're also super expensive. Not everybody can afford them. Where are we at with reusing them, maybe?
Yeah, I mean, these are still disposable masks. You have to go based on the manufacturer instructions. Most of them have about an 8-hour one-day life, so kind of 8 1-hour uses or 1 8-hour use. You do want to be careful about reusing masks as they do wear down in efficacy, and straps may also break with repeated use.
Okay, fair enough. Thank you. The NHL says it is taking action to deal with rising COVID-19 cases, but there are questions about what should happen next.
How important is it that they press on with games, even at the risk to the health of their players?
When we come back, we'll look at the decision facing professional sports leagues and their fans.
Well, Omicron's impact is also being felt throughout professional sports. Just tonight, the National Football League announced 94 players tested positive for COVID. And as Aaron Collins shows us, the virus has also forced many pro hockey players off the ice.
The Calgary Flames off to a red-hot start this year. But with 16 players and counting out with COVID-19, their season is on ice for now. The team's games postponed until at least next Tuesday.
It's tough and it's draining, and it's, like I said, there's that fatigue factor, but this is just part of life now.
Dozens of NHL players have come down with COVID in recent days. The league's answer to the spike in cases tightening its COVID rules, but more hard questions loom.
How important is it that they press on with games, even at the risk to the health of their players?
NHL players are also set to return to the Olympics in the new year, but some of hockey's biggest stars are thinking twice.
Obviously, I'm still a guy that's wanting to go play in the Olympics, but we also want to make sure it's safe for everybody.
From pro football in the U.S. to pro football in Europe, COVID has leagues around the world scrambling to save their seasons. Amateur athletes are impacted too. The World Junior Hockey Championship is set to start in Alberta over the holidays.
Play in a bubble, so I think it's really cannot be much safer than that, I think. So no big worries.
And fans should be safe in packed arenas too, according to Alberta's premier.
That we have not seen widespread community transmission from those large events that are compliant with the rules.
But not everyone is so sure that full stadiums make sense anymore.
At the present time, if I understand, let's say sports events, arenas, hockey arenas are still at full capacity, that's something I think that needs to be looked at.
Today, Ontario did just that, limiting fans in big sports venues to half of capacity. So with games on the line, COVID once again has athletes and fans alike on the edge of their seats. Aaron Collins, CBC News, Calgary.
Time for a quick break. Next, though, we will take a moment with the doctors to talk about what happens next. The special edition of The National. We'll be right back. Welcome back. Tonight, we dedicated the show to really understanding the Omicron variant and how it is changing the course of this pandemic. Obviously, we could not have done it without the help of the infectious disease doctors.
Yes, that is definitely true. And normally, this is sort of the point of the program where we bring you the moment. Tonight, we are going to turn things over to them, to the doctors, to take a moment to tell us what gives you hope for the coming days. Dr. Chagla.
Yeah, I think two things. One, the fact that so many Canadians have rolled up their sleeves, and I would be so much more scared of Omicron right now if we were not immunized. And number two, I think we're realizing this is a global disease, and we're coming to that conclusion so much more. And I have a lot of hope that 2022 is the year that we recognize our global need to really stamp out this pandemic.
And Dr. Wong, what about you?
Everybody is really, really tired right now. We all get that. At the end of the day, it's about taking responsibility for ourselves as well as for our friends and our loved ones by making good choices. And I think it's important for us to remember that we're all in this together, regardless of COVID or no COVID, whether you're vaccinated, not vaccinated. At the end of the day, I think it's important to be patient, kind to one another. Hate, blame, anger, those things never really helped us as a society move forward in any positive way.
And Dr. Barrett, bring us home. What gives you hope?
So hope, Canadians have come together before throughout this pandemic, once, twice, 3, 4 waves. We've done this and we've done it well so far. We have all the tools in our toolbox right now to be able to do this again with a firm and clear horizon coming forward. And you know what? That gives me hope. I know we can do this.
All right. Hey, thank you so much to the doctors. And before we go, tomorrow, The Current's Matt Galloway will be hosting a CBC Radio call-in special. He will be joined by Dr. Brian Goldman and psychologist Dr. Jackie Kinley to answer your questions about COVID, how to stay safe this holiday season. Tune in at 1 p.m. Eastern on CBC Radio and on the CBC Listen app.
And that is a national for December the 15th. Good night.
Good night.